Hey everyone, welcome to today's Explainer. If you're a focused learner looking to get straight to the facts, you are absolutely in the right place. Today, we're going to completely reframe how you think about treating a problem that plagues millions of people, knee osteoarthritis. If you, or maybe someone you love, has ever winced while just taking a step, or felt that deep, nagging ache after a long walk, you're going to want to pay close attention. We're looking at some truly fascinating recent research that is about to flip traditional rehab completely upside down.
Okay, let's dive into this. What if fixing your knee pain actually meant, well, ignoring your knees? I know, it sounds totally counterintuitive, right? Almost like a riddle. We've been taught our whole lives that where it hurts is exactly where the problem is. But today, we're going to challenge your most basic assumptions about joint pain and show you why looking away from the knee might actually be the key to saving it.
All right, Section 1, the knee pain epidemic, a universal problem.
Get this, 22.9%. That is the staggering global prevalence of knee osteoarthritis for adults over the age of 40 worldwide. I mean, just think about that for a second. Nearly a quarter of the population over 40 is walking around with degrading cartilage, persistent disability, and daily pain. The stakes of this medical issue are absolutely massive, which is exactly why finding an effective treatment is pretty much one of the holy grails of physical therapy. Now, for decades, the medical community has relied on a very specific status quo. Traditional rehabilitation focuses almost exclusively on the knee joint itself and the large muscles surrounding it, so primarily strengthening the quadriceps. And honestly, the logic makes sense on the surface. Build a stronger quad and you decrease the compressive forces bearing down on that damaged joint. But despite this, people are still suffering. So what on earth are we missing? Which brings us to Section 2, a surprising root cause beyond the knee.
So the crucial point here is understanding this concept of the kinetic chain. See, the human body isn't just a collection of isolated parts. It's a highly complex system of linked joints and muscles. Movement or instability at one joint directly and heavily affects all the others. Imagine a building. If the core foundation of that building is weak or uneven, the supporting pillars, which in this case are your legs, end up taking all the mechanical stress. And researchers have actually identified a missing link here, the transverse abdominis and the multifidus. These are your deep proximal core muscles. If you have poor core stability here, your pelvis wobbles. When your pelvis wobbles, the mechanics of your walk completely change, and guess what absorbs all that erratic shock? Yep, your knees. This poor core foundation has now been identified as a highly plausible avenue contributing to the rapid progression of knee osteoarthritis. So this sets up a really sharp, revolutionary contrast. On one side, we have the traditional approach, right? Stare at the knee, strengthen the quad, and kind of just hope for the best. On the other side, we have this completely new approach. Stabilize the proximal trunk and the pelvis. Build a rock-solid core so that the mechanical stress is distributed evenly, totally offloading the pressure from that injured knee joint. It is a total paradigm shift. Let's move on to Section 3, the CARE-COA solution, Core Activation Protocol. And this brilliantly illustrates exactly what we're talking about. The clinical trial testing this out didn't rely on intimidating heavyweight gym workouts requiring thousands of dollars of equipment. Not at all. They used highly accessible, really simple floor exercises, things like glute bridges, prone planks, and deep transverse abdominis activations. This is all about precision and stability, not raw, sweaty power. The researchers built a very clean, super structured framework for this trial. Participants did exactly this: 3 sessions a week, 60 minutes per session, which included a warm-up. They combined these specific core activations with their normal routine knee rehab. And here's the real kicker. They only did this for 4 weeks total. Let's see what actually happened in just 1 month. Section 4, putting it to the test, real-world outcomes. So the trial featured a focused group of 15 participants, all over the age of 50. It had a 60-40 split of females to males, and crucially, these weren't just perfectly healthy individuals. These were people officially diagnosed with grade 1 to grade 3 knee osteoarthritis. They had real cartilage wear, and they were in real pain. Now, before we look at the results, I want to act as your translator for a quick second. The researchers used highly validated clinical tests, but let's convert those intimidating acronyms into actual, everyday human life. The 30 STS, that just measures how easily you can get out of a chair. The 40 MFPW, that's your ability to walk quickly and safely, like if you were crossing a busy street. The SCT is your ability to climb a flight of stairs without having to give up. And the TUG test measures how well you can stand up, turn around, and sit back down without losing your balance. Basically, these measure true daily independence.
All right, Section 5, the results are in. Did it save the knee?
Now, what's really interesting about this data is the sheer, dramatic plunge in pain. On a visual analog scale measuring pain during activity, the patients dropped from a severe 6.33 down to a highly manageable 3.87. I mean, that is a massively significant drop in pain. And remember, this happened after just 12 sessions over the course of 4 weeks. But, it wasn't just raw pain scores. It was how they felt about their actual lives. Looking at the KOOS outcomes, that's the knee injury and osteoarthritis outcome score, and higher numbers are better here. Their scores absolutely skyrocketed across the board. Their symptoms improved, their ability to perform daily living tasks surged, and their overall quality of life jumped nearly 10 full points. Their real-world experience fundamentally changed for the better. And the clinical function tests completely backed up everything the patients were feeling. They achieved faster stair climbing times. They could get out of their chairs more times in 30 seconds. They were quicker on their feet when turning. And, predictably, their core endurance significantly improved. Again, this isn't just data on a spreadsheet. This is about a grandmother being able to get up from the floor, or a father confidently climbing the bleachers at a baseball game. But here is where the data gives us a truly fascinating catch. When researchers actually measured the muscle strength of the patient's legs, the flexors and extensors around the affected knee, there was almost no significant change during those 4 weeks. No way, right? But think about why this matters. It proves that the immediate relief they felt didn't come from building bulkier leg muscles. It came strictly from the core stabilization, offloading the mechanical stress from the joint. The foundation got stronger, so the pillars just stopped shaking. Let's move to Section 6, the core takeaway. Final understandings. The ultimate lesson of this explainer is honestly deeply empowering. Core muscle activation stabilizes your trunk and your pelvis. When your center of gravity is stable, the forces of walking and moving are distributed evenly, which drastically reduces the mechanical strain on your knees. You have the power to actively manage and reduce your knee pain, literally just by focusing your attention higher up your kinetic chain.
So, I'm going to leave you with this final thought. Knowing what you know now about the kinetic chain, the transverse abdominis, and the absolute incredible results of the Karakoa protocol, are you ready to strengthen your core to save your knees? Thanks so much for joining me on this explainer today. Keep learning, and as always, keep looking for the root cause.